Today we are going to discuss this Darier disease, which is a cantholitic disorder. This can be easily remembered by this visual mnemonic. To start with, this is a gate of a gem which is showing Ca. Ca is for calcium transporter. So Darier disease is a defect of the calcium transporter. And by the start of the gem, there is a play area which shows a fulcrum which is showing A and two swans that represents 2A2. So the defect is basically 2 ATP2A2 gene that is defective in the Darier disease. This ATP2A2 gene encodes for the SERCA-A, which is a smooth endoplasmic calcium transporter 2. When there is a defect of the SERCA-A, there will be defective sequestration of the calcium, which results in the defective adhesion and acantholysis. Next, you can see the small round bodies and the grains that are fell on the ground that are showing cord rods and grains. So these are the histological finding of the Darier disease. Next, this banner is showing less than 20 years of age. So the Darier disease manifestations are mostly in the younger age, in the less than 20 years of age. Coming to the clinical manifestations, you can see the guy in the gym that is doing exercise and he's sweating, and the green sweat is shown in the seborrheic distribution. So lesions are very verrucous, malformed, and foul smelling in the seborrheic area distribution. By this guy, you can remember the lesions of the skin. And the next guy that is shown doing another exercise, that is bar and weight. The shape of the bar is typically V colored. So the nail of the Darier disease is showing V neck, and the weight is showing typical red and white color. So the colors of the Darier disease is red and white. If you focus the mouth of the guy, that is open, that is showing there is some mucosal lesions in the Darier disease as well, and that is shown by the mat, which is cobblestone pattern. So mucosal lesions are of cobblestone appearance. Next character is that female that is carrying the bag very tightly, where there is some debris falling from the bag. That debris is showing the palmoplantar keratoderma. So there is debris on the palms and soles in the form of palmoplantar keratoderma. And by the falling of some debris, there is pit in the floor. That pit is showing palmoplantar pits. So Darier disease has palmoplantar keratoderma and the palmoplantar pits. Female seems to be sophisticated, but maybe she has some ocular problems. Therefore, she entered into the male gym, and the ocular manifestations are in the form of chronic blepharitis or the debris on the eyelid margin or the corneal ulceration. For association, you can see the guy in the background that is doing the treadmill, and he's carrying the bipolar magnet. So with Darier disease, there is schizophrenia or bipolar disorders, and for the treatment of bipolar, you take lithium. So lithium also exacerbated. Next, at the background, you are showing Caesar, so Caesar salad. By the Caesar salad, you can remember the Caesars are also seen in the Darier disease. Next is your treatment. Treatment is shown by these bottles, which are showing topical steroids that are the mainstay of the treatment. And the next can that is showing acitretin. Acitretin is used in Darier disease, but the lesions are very widespread. They are not much tolerated by the patient. And those are our next step is immunomodulators, which is methotrexate. Methotrexate can be remembered by this mighty dinosaur, which is very green colored and mighty in size. So methotrexate is can be remembered by this dinosaur. So here we summarize the Darier disease. Hope you find it useful, and next we will do Hailey Hailey disease in the next session.